When you're first learning human anatomy from a textbook, everything is just perfectly color-coded.
Oh, absolutely.
Like the arteries are this bright, unmistakable red, the veins are a vivid blue, and the liver is this distinct, smooth shape, just sitting exactly where the diagram says it should be. It's safe, it's clean.
It looks like a neatly organized transit map, right?
Yes, exactly like a transit map. And it makes complete visual sense, which gives you this false sense of security that the human body is just a series of well-labeled stationary compartments.
Right. But then you actually graduate.
Yeah.
You step into a real clinical setting, you pick up an ultrasound transducer, put it on an actual breathing human being, and suddenly...
You're staring at a grayscale blizzard.
Exactly. You're trying to find a gallbladder in what essentially looks like the static on an old television set.
It's terrifying.
It is. Welcome to the real world of sonography. I mean, that moment of pure shock where the color-coded textbook meets the murky, dynamic, grayscale reality of a living patient, that is the exact hurdle every new graduate has to clear.
And that transition is really our mission for today's deep dive. For the listener out there right now, you've survived the gauntlet. You made it through the anatomy and physiology courses, the endless clinical rotations, the practical exams.
It's huge.
It is a massive achievement. You officially graduated from your sonography program. But as a medical student myself, I know that the moment the graduation high wears off, this very specific shadow looms over you. You have to face the credentialing boards.
Yeah, specifically the ARDMS, which is the American Registry for Diagnostic Medical Sonography,
Wow.
or the ART for radiologic technologists.
Right, and it's the ultimate bottleneck, isn't it?
It really is the ultimate bottleneck for your career. You have all this raw data floating around in your head, but now you have to prove to a governing body that you can apply it safely in a clinical environment.
Yeah, and I think that shift in perspective is where so many talented graduates just freeze up.
Oh, entirely.
Yeah.
They look at 2 years of notes and feel totally paralyzed by the sheer volume of facts they think they need to rote memorize.
Which is exactly why we are pulling from a really fantastic source today to help you navigate this final hurdle. We're looking at a comprehensive guide called How to Prepare for a Sonography Board Exam, and it's published by MedClassPass.
It's a great resource.
It really is. It's a roadmap that takes you from graduation day all the way to actually sitting in the exam chair. So, okay, let's unpack this. The guide points out a fundamental mindset shift that has to happen before you even pick up a highlighter.
Right.
These credentialing exams are not testing your memory. They are testing your clinical understanding.
What's fascinating here is that the boards are not actually trying to trick you.
Even though it feels like they are.
Oh, I know it feels like they are. When you're staring at a multiple-choice question with 4 answers that all look technically viable, it feels like a trap. But these exams aren't designed by enemies trying to keep you out of the profession.
Right.
They're designed to answer one question. Can you safely diagnose real patients?
Yeah. Like, can you recognize dangerous pathology versus just a normal anatomical variant?
Exactly. Do you actually understand ultrasound physics well enough to explain why a weird echo appears on the screen, rather than just reciting a textbook definition of a sound wave?
You don't need to memorize the entire encyclopedia of medicine.
No, you just need enough foundational knowledge to solve actual clinical problems.
So the goal is to be a competent clinician, not, a trivia champion.
Well said.
So let's get into the actual mechanics of preparing for this. The guide is incredibly clear that the absolute worst thing a new graduate can do is open a review book to page 1 and just start passively reading.
Oh, please don't do that. That is a recipe for overwhelming anxiety.
Because you're just drowning in text.
Exactly. If you do that, you are studying without a diagnostic blueprint. The very first step, according to the source, is to go directly to the official ARDMS or RT website and download their content outline for your specific specialty exam.
That document is basically your holy grail.
It is. It tells you exactly what categories you will be tested on and, crucially, the mathematical weight of each category.
Which is so important to know.
Right, because you need to know if liver pathology is 20% of the exam, while medical ethics is only 5%.
It's like trying to navigate a sprawling, unfamiliar city. You wouldn't just start driving down random streets hoping you eventually bump into your destination.
No, you'd be lost in 5 minutes.
Right. You need the topographic map first to tell you where the major highways are versus, the dead-end alleys.
That is a perfect way to frame it. Once you have that official map, you gather all your fragmented material.
All the stuff from school.
Yeah, your lecture notes, the clinical logs, textbooks, physical flashcards, image atlases. You consolidate them into either a centralized digital folder or a massive physical binder.
But sorting everything strictly by the categories listed on that official board outline.
Exactly.
Let me challenge this a bit, though, because as a student who has definitely spent a whole Sunday just color coordinating my computer folders instead of
Yeah.
actually reading the material, isn't this giant organization project just a, highly productive form of procrastination?
I mean, it absolutely can be a trap if you never move past the gathering phase.
Right.
But consider the alternative. If you don't build a centralized system up front, 2 weeks into studying, you'll inevitably interrupt your cognitive flow for an hour,
Yeah.
tearing apart your apartment,
Yeah.
trying to find one specific lecture handout on Doppler shift principles.
Oh, I've been there. It's the worst.
The goal is to remove friction from the actual studying process.
Yeah.
But you bring up a crucial point about the danger of procrastination, which is why the source pairs this with an immediate, non-negotiable next step.
Oh.
The moment your binder is organized, you must officially pay for and schedule your exam date.
Wait, right then. Like, even if you haven't reviewed a single concept and feel completely unprepared.
Especially then. Waiting until you feel ready is an illusion.
Because you never feel ready.
Exactly. That day mathematically never arrives because there is always one more rare pathology you could review.
Yeah.
Scheduling your exam does something profound to the human brain.
Yeah.
It takes this abstract, terrifying ghost of the board exams and forces it into reality. It becomes a concrete date on the calendar.
Right. It creates a sense of urgency. The deadline becomes real, which forces your brain to allocate resources to it.
Precisely.
Yes.
Because once you have that hard date on the calendar,
Yeah.
you can begin reverse engineering your study schedule based on the exact number of days you have left.
And the source outlines a few different paths for this, right?
It does. But the most sustainable one, especially for those balancing a job, family, or just, normal life, is the 12-week plan.
So let's break down the mechanics of this 12-week timeline, because the order of operations here is really intentional.
It is very structured.
So the first 2 weeks are dedicated to patient care, medical ethics, and ultrasound safety. That makes sense to me. You're grounding yourself in the reality of treating human beings before you get into the abstract science.
Right.
But then, in weeks 3 and 4, the plan has you tackle physics, instrumentation, and Doppler principles.
Yes.
Why front-load physics? I mean, I know so many students are terrified of the physics portion and want to push it to the very end.
It's a very common fear,
Hmm.
but putting it off is a huge mistake. Physics is essentially the grammar of ultrasound.
Oh, I like that.
Yeah, you can't read the complex sentence of a diseased liver if you don't understand the grammatical rules of how the machine actually creates the image in the first place. You have to tackle those abstract concepts while your mental energy and motivation are at their absolute highest.
That makes total sense. You master the language of the machine first.
Exactly.
Then, in weeks 5 and 6, you move into the abdomen, specifically grouping the liver, gallbladder, pancreas, and spleen.
And we group those together because they interact anatomically and share complex vascular supplies. You can't truly understand biliary obstruction in the gallbladder without understanding the plumbing of the liver.
Right, it's all connected.
Then, weeks 7 and 8 shift downward to the kidneys, the urinary system, and the retroperitoneum.
Okay.
And weeks 9 and 10 widen out to cover obstetrics, gynecology, small parts, and a comprehensive vascular review.
So by the end of week 10, you have systematically mapped the entire human body and the physics required to visualize it. What happens in those final 2 weeks?
Week 11 is purely diagnostic.
Meaning what exactly?
You do a comprehensive review of only your weak areas, the specific concepts you consistently got wrong during the previous 10 weeks.
Oh, smart.
And week 12 is a strict lockdown. Exclusively practice exams, image review, and light maintenance. You absolutely do not attempt to learn new material in week 12.
That's a very logical progression. But the source does mention other timelines for different situations, right? If a listener has a really robust foundation, maybe they just ace their clinical finals and everything is fresh. There's an 8-week plan.
Yeah, the 8-week plan requires more stamina. You're studying 6 days a week, dedicating each week to one massive subject block. The defining feature here is that you incorporate daily practice questions right from day one, rather than waiting for a review period.
Got it. And then there's the 4-week intensive plan.
Yes.
Honestly, attempting to compress 2 years of medical science into a month sounds like a fast track to severe burnout. How is that even physically survivable?
Well, it's not recommended for everyone.
I would hope not.
It is strictly designed for highly disciplined recent graduates who do not have full-time jobs and can treat the board prep as their 9-to-5 occupation.
It sounds brutal.
The structure is relentless. Mornings are for dense topic review, afternoons are exclusively for running practice questions, and evenings are for drilling flashcards and reviewing grayscale images. It is a grueling sprint.
Yeah, no kidding. But having a perfectly spaced, color-coded calendar doesn't matter at all if the hours you spend staring at the textbook are wasted.
Right.
How do we ensure the brain is actually absorbing this data?
This is where the highest volume of time is wasted by students. They try to study using methods that actively fight against their own cognitive wiring. You have to tailor your tactics to how your brain processes data.
So let's dive into these learning styles because they map onto sonography in really specific ways. Visual learners are the obvious starting point.
Sure.
Sonography is an inherently visual medium, but the guide warns against just highlighting text. If you read a paragraph describing a diseased kidney, that text is useless unless you are actively comparing a normal ultrasound image and an abnormal one side by side.
Text is just noise to a visual learner until it becomes an image. You should be drawing anatomical flowcharts and building visual mind maps. Now, if you are an auditory learner, you process data through sound. You should be listening to educational podcasts or audio lectures during your commute. But the source highlights an even more powerful auditory tool, which is teaching the material out loud to a family member or classmate.
I've always wondered about the psychology behind that. Why is forcing your poor partner to sit on the couch while you explain the acoustic impedance of a gallstone so effective?
It has to do with the cognitive bottleneck of human speech.
Oh.
When an idea is just floating in your head, it's a messy, interconnected web of vague concepts. You can easily trick yourself into thinking you understand it.
Oh, I do that all the time.
Right. But to speak it out loud, you are forced to take that messy web and push it through the bottleneck of language, organizing it into a linear, logical narrative.
Wow, yeah.
If you stumble, or if your partner asks a basic question you can't answer, it immediately exposes the gaps in your actual understanding.
That is brilliant. You can't fake a verbal explanation.
Exactly.
Then there are reading and writing learners. The instinct here is just to rewrite lecture notes, but the guide gives a very sharp warning. Copying textbooks word for word is a trap.
Copying is purely physical labor. Your hand is moving, but your brain is turned off. To make it effective, you have to read a complex chapter, close the book, and synthesize the information into a summary using your own words.
It's that translation process.
The translation process is what cements the memory.
And for kinesthetic learners, people who learn by physical movement, it's about getting your hands on the transducer.
Yep.
And if you don't have access to an ultrasound machine, you physically draw the organs from memory on a dry erase board or trace anatomical structures on printed images.
Anything to make it physical.
Right. But the guide elevates all of these personal styles by introducing two massive, evidence-based scientific principles, active recall and spaced repetition.
These are the twin pillars of memory retention. Active recall means that instead of passively rereading a chapter, which creates that dangerous illusion of competence, you look away and force your brain to retrieve the information from scratch.
Like using flashcards.
Exactly. It physically strengthens the neural synapse every time you force your brain to struggle for the answer.
It's uncomfortable, but the struggle is the mechanism of learning.
Yes.
And spaced repetition is the vehicle for that recall. How does that physically alter memory?
Think of your brain's neural pathways like a hiking trail in an overgrown forest.
Okay.
If you walk it once, you bend the grass a little, but it grows back by tomorrow. That's cramming.
Right.
Spaced repetition is walking that exact same trail right as the weeds are starting to grow back, say 3 days later, then a week later, then a month later.
Keeping the path clear.
By continually reopening the pathway, just as it begins to degrade, you eventually carve a permanent dirt path. The information moves from fragile short-term memory into permanent clinical intuition.
Here's where it gets really interesting, though. The guide stresses that in sonography, this cognitive science has to be applied to image recognition, not just vocabulary.
This is crucial.
Yeah, you can use active recall to memorize that a hemangioma, which is a benign tangle of blood vessels, appears hyperechoic on an ultrasound. But if you don't know that hyperechoic means it reflects a lot of sound waves and therefore shows up as a bright white mass on the screen, that vocabulary word is entirely useless to you in the clinic.
You have to train your eyes. The brain has to be able to recognize the baseline of normal anatomy so intimately that any tiny variant, artifact, or disease pattern instantly triggers an alarm bell.
So we have our timeline mapped. We understand the cognitive science of how to study. What actual tools should the listener be using? Because if you search for sonography board prep, you are hit with a tidal wave of resources, and it can be financially intimidating.
The landscape is vast, but the source objectively categorizes the most reputable options into paid and free tiers.
Let's start with the paid ones.
On the paid side, you have comprehensive platforms like My Ultrasound Tutor, which offers structured guided lessons.
Yeah.
There's ESP Ultrasound, heavily utilized for its physics seminars. Davies Publishing is a staple for physical review books and mock exams.
I've seen those books everywhere.
Yeah, they're very common. Penny review books are also widely used across programs. And URR, Ultrasound Registry Review, is known for its massive, rigorous question banks.
And what about the free options for students who are tapped out on tuition?
Well, the official ARDMS or ARRT content outlines are entirely free and, frankly, mandatory.
Right.
And the source we are analyzing today, MedClassPass, operates specifically to provide high-quality, evidence-based prep resources without a massive paywall.
Okay, if we connect this to the bigger picture, paying for an expensive tool does not bypass human biology.
Not at all.
A $400 question bank doesn't magically download data into your cerebral cortex. You still have to do the physical work of active recall.
A premium resource might organize the data beautifully, but your brain is still the engine that has to process it.
So the listener has done the work, they've hiked the mental trails, they've used the resources. Suddenly, it's the day before the exam. What is the psychological strategy for this final 48-hour window?
The day before the exam is entirely about physical and mental preservation. You are no longer building the house, you are just sweeping the floors.
I love that.
Hydrate, eat normally, map your physical route to the testing center so you aren't spiking your cortisol in traffic. But the cardinal rule is, do not attempt to learn entirely new concepts.
So if I realize I completely skipped an obscure pancreatic disease in week 5, I just have to let it go.
Let it go. The anxiety generated by trying to cram a complex new disease will flood your brain with stress hormones, actively compromising your ability to recall the 95% of the material you actually do know.
That makes sense. And when you finally sit in the testing chair and the digital clock starts counting down,
read every single question with deep suspicion. Board exams routinely include absolute words like always or never. In biology, very few things always happen, so those words change the entire validity of a statement. Eliminate the obviously wrong answers immediately to improve your statistical odds.
okay.
And if you hit a question that totally paralyzes you, flag it and move on. Do not let one question drain 10 minutes of your time and derail your psychological momentum.
What about the urge to second guess? The psychological dissonance of multiple choice tests always makes me talk myself out of the right answer.
Oh, everyone does that. But the source is adamant about the golden rule of testing. Your first, well-reasoned instinct is usually tied to state-dependent memory.
So go with your gut.
It is usually right. You should only ever change an answer if you have a concrete, specific realization, like suddenly remembering a specific physiological pathway. Never change an answer just because you feel a vague, generalized sense of doubt.
So what does this all mean? If we step back and look at this massive journey from graduation day to the testing center, passing your boards isn't about achieving a state of absolute encyclopedic perfection.
No, it's not.
It is an exercise in strategic preparation. It's about respecting your cognitive limits, choosing a timeline that fits your reality, utilizing the science of active recall rather than passive reading, and ultimately trusting the clinical reasoning you've spent years developing.
This raises an important question, though, especially regarding what happens the day after you pass the exam.
Oh.
We've established that the boards are testing your ability to make safe clinical decisions in the real world, rather than rewarding you for memorizing textbook scenarios.
Right.
So how might an over-reliance on those perfectly clear, color-coded textbook images actually become a liability when you have a real complex patient in front of you?
That's a really provocative way to look at it.
Consider the concept of ultrasound artifacts. When you are a student preparing for a test, an artifact is usually framed as an annoying physics glitch, a degradation of the image that you just have to memorize for a multiple-choice question.
Right, like it's a mistake.
Take posterior acoustic shadowing, for example. That's when sound waves hit something dense, like a gallstone, and bounce completely back, leaving a literal black, empty shadow on the screen below it.
Yeah.
On a textbook diagram, that shadow ruins the perfect picture.
Ugh.
But in the murky grayscale blizzard of a real clinic, that glitch is exactly what you are looking for.
Because it proves the stone is real.
Exactly. That shadow is the undeniable diagnostic fluke that proves the stone is there. The imperfection of the image is the exact mechanism you will rely on to save the patient's life.
Wow. The messy reality isn't the obstacle. The messy reality is the actual job.
That's the job.
And these exams are simply the gatekeepers, ensuring you're ready to step into that reality and do no harm. To everyone listening who is staring down this final hurdle, trust the grueling work you have already put in.
You've got this.
You've survived the clinical programs, you now have the blueprint, and you understand the cognitive science of how to prepare. Thank you for joining us on this deep dive. Take a breath, go schedule your exam date, and trust your training.